Okay, so if everyone could take a moment. All right. Well, good afternoon, everybody. Happy Monday, November 13th. Yesterday was the beginning of Nurse Practitioner Week. So, everybody, give yourself a woo, congratulations. Thank you for all that you do. And Dr. Mazicki has his Buffalo Bills out. And for all you sports fans, celebrating your sports. Um, I have the pleasure of being with you all today. I'm Desiree Branson, president of the NPA this year. And I have three wonderful panelists with us today. We thought we'd give you a little bit of a brief overview about owning your own practice. So, with us today is Dr. Henry Mazicki. He's our Region 2 director. We have Dr. Donna Willenbrock from down in Region 7. Remember, there is nominations going on for treasurer right now. And we also have Dr. Ellen Batista. Everyone's icons are moving. Up in my top corner is Region 1 director. So I'm going to start out with some questions to our panelists. So maybe if we go, let's see, how about just like 1, 2, 3, which would, or in that order, which would be like Ellen, Henry, and then Donna. Okay, for region 1, 2, and then 7. Okay, so Ellen, if you'd like to get us started. So the question is to our panelists, how long have you been a nurse practitioner and what is your specialty?
I've been a nurse practitioner since 1981, but I have two specialties. I started out in pediatric oncology, but the majority of my practice time has been in pain management.
Wonderful. Thanks, Ellen. Dr. Mazicki.
I have been in practice, well, as a nurse practitioner since 1995. And since then, I am a family nurse practitioner. Of course, I have my own practice, but I've found my way to that through a lot of different avenues. I worked a little bit orthopedics. I worked with urology. I've done some geriatric care and, of course, family practice.
Awesome. Thank you. And Dr. Willenbrock.
Hi, I've been a nurse practitioner for 15 years now. I had to just do the math. So I'm the baby of the group. I'm an adult nurse practitioner, and I've been in palliative care, pain management, pulmonary, and then mostly primary care after that until I got to my own practice.
Excellent. Now, here's the big question you're all looking for to our panelists. What made you decide to go into your own private practice? Ellen.
I'll start. I decided to go into my own practice, believe it or not, at the recommendation of physicians I worked with. They felt that I would have more autonomy and more economic growth if I were in my own practice. And so I took them up on that. That's exactly what I did.
That's great. Henry.
I was kind of a pioneer in my area of family practice. I was working with a internal medicine doc and a doc who was in family practice in a neighboring community in Leroy, New York, was retiring. So again, just like Ellen, it was recommended to me by the physician that I was working with. He said, "Hey, this opportunity is here." At that time, we had collaborative practice agreements. So he said, "Hey, if you want to try this on your own, I'll back you. I'll be your collaborator." So knowing nothing about anything, I said, "Well, oh, sure, I'll do it," and off I went. And I learned everything through my failures. So that's kind of how I learned all this stuff. But if I were to do it again, I think I would do it the same way.
And we're going to ask you, that's going to be one of our upcoming questions about the trials and tribulations. Dr. Willenbrock.
So I would say I did it for the reason that Ellen said, for autonomy. I worked for great practices. I mean, I love my physician partners. They were always very supportive, but, it wasn't my practice. And, I wasn't ever going to be a partner in a practice. So, I wanted to spend more time with my patients to focus on the things that I thought were important, that holistic approach. So the best way to do that was to go out on my own. And when the law changed and I could have an independent practice, I jumped. And then we'll talk about trials and tribulations later.
Yes. Okay. So now back to Ellen. So how did you actually get started? What were those steps that you actually took? Sure, a lot of our audience members want to hear about that.
Some of it will still exists. I mean, you have to have a collaborating provider, and I had a physician who was more than interested in me doing that. He had actually been from the practice that I had recommended I start my own practice. And then what we did as a group, just to make it more economically feasible, is that 3 of us rented one space, and we shared resources such as personnel, billing, and those sorts of things, and kind of worked out. And as each group grew, we kind of separated because we didn't have enough space. So that's kind of how I started. But of course, things evolve over time, so that you know, it's easy to get empaneled in a insurance carrier, but to be with the updated rules and stuff, I eventually did get my own biller so that I'd have more control over that. I realized that ultimately not only sets you up fiscally, excuse me, but also you want to be in control of that, because if you're going to get in trouble medically, it's going to be how you bill. So I wanted someone who knew, a group that knew what it was going to do. And then what was the question again? I can't remember what else you asked me in that.
Really, about how did you get started and what steps did you take?
And from there on, because I had been working in the area in pain management for a long time, and my practice is pretty old. I started in 2001. I had known a lot of physicians and nurse practitioners, and I got a lot of referrals that way. In fact, the group that I left referred all the pain patients to me. So that really got my numbers started. And then I think the other thing you have to do is figure out how you want to practice. How much do you need to make to support yourself and to pay off your bills? And what kind of policies do you want to develop? And so those sorts of things are important to do early on.
Great, thanks, Ellen. So Henry, what was your path?
Well, you heard a little bit about that. So I graduated in 1995, and 1999 this opportunity came along. And you know, during that time, you always have this dream. Well, you know what? If I were to own my own practice, I would do things this way, or I'd treat patients this way. So all those things, you know, drove me to do this. But being as naive as I was under the impression that, hey, you know, I'm a licensed NP. All I have to do is hang out my shingle and start seeing patients. But that was far from the truth. Like I said, there was a lot of things that I learned along the way that nobody really tells you. You have to kind of seek those things out. I remember my first year, I lost $25,000 just from lack of billing, because I just didn't know. I didn't know that you needed a biller. I didn't know that you needed to be credentialed. I didn't know any of that stuff. So those are the kind of things that I was experiencing, and they were kind of a lean time for me, but eventually, as you can see, it worked out.
That's fantastic. Well, and that's why we're here to share best practices and everything that all 3 of you have gone through in the development of your own practices. I appreciate that. Donna, how about yourself?
Well, you know, I had an idea, you know, I had the dream, and I was all right, what do I want to do? And I wanted to see patients, as I said, holistically. I was doing a lot of lifestyle management, you know, managing patients living with the disease of obesity. So I said, you know what, this is where I want to go. So then I went out and said, okay, so how much is it going to be for a brick and mortar location? And then went, wow. Oh, there's a lot of expenses here. You know, not only do you have to guarantee your landlord your couple of months rent, but, you know, there's also the phone, and there's, you know, all of the other things that go with it. So I said, all right, well, that's not the path we're going to take right now, because that's a lot of outlay of cash. So, you know, I'm a paralegal. I was in business beforehand. So I wrote up a business plan. I actually went to the Small Business Association and met with someone who gave me like tremendous guidance in terms of how to get it all started. I did my own LLC. I went to New York State, has the Department of State has a whole thing how to do your own LLC. So I did that. I talked to Office of the Professions to find out about simple things like, what do I call my practice? And they were really great, like just telling me, don't ever put the word medical in anything you do and you're good. So I started that way. I started doing house calls, which I really enjoyed. I had a biller that helped me at the time. And then, that person moved. So then I moved more towards cash pay because getting on insurance panels was a little difficult. I was on some already, but the requirements were almost onerous in some cases, because there would be Empire Blue Cross Blue Shield, this particular version I was in, but not that version. So somebody would ask me, oh, do you take Empire Blue Cross Blue Shield? And I go, yeah, of course I do. And then to find out, no, I don't. So like Henry, I lost some money because I didn't know all the little nuances of the insurance panels and what that requires. So a lot of trial and error, going to people for guidance, but the Small Business Association was so helpful, in pointing me towards like if I wanted loans, grant money, and just how to put together, a business plan that made sense and that would work.
That's great. And I'd love to hear, I'm a faculty and we teach about business plans and proposals. So for any of you students out there, these things come back, right? Very important. Okay, going back to Ellen. So I know Henry and Donna already started talking a little bit about the biggest challenges, but maybe you could talk about a couple of yours. And Donna already started alluding into about insurance. So as we talk about challenges, also, do you accept insurance? Which ones do you accept? How is that going?
Oh, that's a big question. So
Okay.
in part depend on what patients you're treating. So I did pain management, so workers' comp was a big portion of my practice, at least half of my practice. And then it broke down to about 20% Medicare. So you have to decide what you're willing to do. And if you're going to take workers' comp or no fault, it's a lot more work, but it's a lot more money. So you have to decide what you want to do with it. Surprisingly, though, workers' comp is the easiest one now for nurse practitioners to get on because a lot of physicians aren't taking it. But you kind of have to understand the guidelines they have and you have to understand the rules. With other insurance carriers, you have to decide whether it's worth it. And that sounds terrible. And I felt terrible because what I ended up doing is a big practice decided to, in pain management in my area, had decided to release 10,000 Medicaid patients. Well, I knew I couldn't survive on Medicaid alone, and I knew what was going to happen. So I went to, if you were a patient of mine and had been regularly insured, I continued on with you. If you ended up with Medicaid, but I took no Medicaid, or and different people, you'll hear everything, but I'm a rules follower. So if they were Medicare, Medicaid, and they were new patients, I would not take them because they didn't want to not bill Medicaid. And so it's always trial and tribulation. That's why you need to make sure you have the best biller you ever can have that is ethical and responsible, because it's not only billing out that's a problem, it's that person who's going to call back and say, okay, why didn't you pay me? What's wrong? Why am I not getting my word? And I tell you think it's going to be workers' comp and no fault because you're dealing with adjusters, but try to get money from the federal government. It's about impossible. So you really need someone who's going to put their effort towards that. And why do that? Because it does affect patient care. If you can't afford your expenses and you don't have income, your patients aren't going to have a provider for very long.
Some great words of wisdom. And Dr. Mazicki, you had started talking about these challenges and about insurance. Can you just expound on that a little bit?
Yeah, just to piggyback on what Ellen said, it isn't just a thing of, you just look in the paper and find somebody that does medical billing, right? That's the wrong way to do it, because that's the way really I did it. I found that everybody would like to help you, but they don't have the wherewithal to do it as a nurse practitioner. And what do I mean by that? A biller is not a biller is a biller. Billers who are knowledgeable in billing for NPs are the ones you want. If they have no experience in billing for an NP, don't go there. Because I've had a few billers that billed as if I was a physician, and it did not work. That's how I lost a lot of money. So that took me a little while to figure that out. But finally, someone came along and said, you know what, people are doing this wrong. This is the way you need to do it for nurse practitioners. And they'll take you through the credentialing and all that stuff. And by the way, the credentialing, it's not that like you just submit the application and bingo, there it is. It probably will take you upwards to about 90 days to get all credentialed. You most notably want to be Medicare credentialed, and then you have to decide if you're going to do the Medicaid or not. The Medicaid reimbursement has just went up. But we all know that the reimbursement is still not as good as some of the other payers, right? And some of the other payers are still within that mindset of physicians, right? Like we don't need to have collaborative agreements, but I know one insurance company in particular will continually hound me and ask me who my supervisor is, who my collaborating physician is, my supervising physician is. And no matter how many times you tell them or try to educate them that, you know, this is not what it is right now, they don't care. That's their guidelines. You're making a contract with them. They don't have to follow that if they don't want to. And that's the same way in many of your facilities. The most things that come up is signing the charts. They don't have to sign the chart, but the facility makes them, right? They don't have to review your charts, but the facility makes the rule that way. So did I answer the question?
Yeah, absolutely. And I think that's really important for a lot of folks that are working within our institutional systems. We know that we have to, when we go on the systems, we may have to sign on and it says who is your collaborator or your supervisor and the attestation forms, right? We know that institutions can do that in the insurance companies beyond what the bills are. So stay tuned for more about NPMA 2.0 to 2.5 as we move through that this year. Donna, if you could just expound a little bit more, you started talking about insurance, but what has your experience been with your practice?
Well, I mean, some of the same things that Henry and Ellen have said. I mean, Medicare was very easy to become empaneled on. I had been already before I switched over to my own practice. I was on Medicaid, and then I was on a lot of commercial insurers, but I found out right out of the box, some commercial insurers would just deny a claim for absolutely no reason. So I would be, and I'm sure you guys know who it is. I mean, they would just deny it. And then we'd have to reprocess a couple of times, not change anything, but continuously reprocess before they say, oh, yeah, we'll send you the money. So it got to be very frustrating. I did a lot of my own panels, so I went in to get credentialed. It was time consuming. I'm told now by a lot of other people that it takes, like 6 months or longer for some of these insurance panels to accept you, even though they've got everything they need. I'll get asked for silly things back. So I went to cash pay. I felt badly about that as well, because, I wanted to, be able to see patients, but also to be able to pay bills and things. So what I did for like my Medicare patients is that I took a copay from them. Instead of charging them what I might normally charge, I just charged them the copay so that I could continue to see them and we could still meet their healthcare goals.
And if I can just interject, what Don was talking about, DPC, direct primary care. Now, when we all started, it was heavily weighted with insurance payment for the people that you see. But now what's coming more and more into light is this DPC model, which is a direct primary care model. I was looking for Matt Simone, but I'm not sure that he's on the call or not. And that seems to be working out. And there is even physicians jumping on this model also, because they're just tired of the rigor of the insurance companies. So more and more people are going to this DPC model. And actually, I myself have been kind of looking at it. And my business advisor, she had talked to me a couple years ago and tried to get me to go to the DPC model. So if you are considering to do this at all, I would go out and I would get all the information that you can on DPC models and traditional models, and then go from there to see what kind of fits what you're trying to do.
Can I just say, Henry, I think now too, a lot of physicians are being charged. I hadn't been, I don't know if you guys are, charged a fee for processing now by the insurance companies. So they've added in another little charge. So in order to get your reimbursement, they've been tagging on additional fee to your reimbursement for having processed your reimbursement, which is a little crazy because, wait a minute, I'm doing this for you. I'm sending in everything. And then you're going to charge me, you're going to take off 50 cents or whatever it is. It's a small amount of money, but it adds up if you have a lot of claims.
Yeah, no, that's a good point. And they are kind of nickel and diming. And I think that's what's driving providers in general away. And that just goes to show you how broken this system is that we have.
But we're so happy that all of you are a part of it. Right, the grassroots effort of trying to help our healthcare system. So with that being said, I'm sure a lot of folks are very interested in, so why did you even do all this? Why did you take the interest in devoting all this time to start your own practice? And what advice would you give someone who's just starting out? Ellen, back to you.
Why do it? I think it is for the autonomy and providing the care you want to provide. And I think that was the biggest benefit I've had. And, I was blessed that I've followed a lot of people up to 30 years. But I could choose what I thought was right and wrong, and what I found in a lot of the medical practices that I had practiced in, and without criticism to them, but they weren't up to date in current standards that I felt were important. And automatically now they do, because you could see that they were not monitoring people for addiction, and that's in my specialty. But I love doing what I did. Is it scary sometimes? Absolutely. Because you always I always second guess. I used to say patients used to come and visit me at night when I was sleeping, and and that's kind of scary. But on the other hand, you know what? Patients really appreciated when I call them at 7:30 in the morning. Look, I was worried about you. I was thinking about you, and I wanted to see how you were doing. The other thing that I felt was important was, and Donna alluded to this, was spending the time that I thought was appropriate for that patient. You all have to go by a schedule, but when you're working in a group practice, I'm amazed, and I don't know how people do it, how they see 40 to 60 patients a day. I could decide that my cutoff with that, in my case, was anywhere from 24 to 28. And patients respected the fact that if I needed extra time with a patient, I may be a little late in seeing them. But I think that's why, and being able to provide the care you feel passionate about is important.
No, that's really important. And Ellen, a little different with yourself than our other two panelists. You just recently have retired from your practice.
I did.
Yeah, maybe could you maybe after we go through Henry and Donna, maybe you could talk a little bit about, we're talking about winding up and having our own practice, a little bit about, how do you then at some point break down that practice? Will be interesting, I'm sure, for our group. Thanks, Ellen. Henry, go ahead.
I asked myself that original question probably a lot. The older I get, why do I want to do this? probably for the same reasons, with Ellen and Donna, right? I mean, we see the right things that we want to do, and we see them continually being the wrong way. And the wrong way is really the norm. And it was becoming the standard, and I didn't like it, right? So if I didn't like it, I had to change it. So that's why when the opportunity came for me to do this, that's why I did it. And for that, I wouldn't change it. And I changed the way that I saw patients, 30-minute visits, right? And sometimes I see that more and more now happening. And I'm so glad that that is changing a little bit, especially for the elderly patients, right? You can't see them in 10 minutes. There's no way, right? Because they need that time to respond to you for age-related changes that they go through, first of all. So I don't know how you can be comprehensive and accomplish that. But it's those kind of things, going out to seeing the patients where they are, doing house calls, those types of things, bringing healthcare to them where they can't find it. So it's kind of those reasons, being autonomous, doing things the right way, and I guess being a leader.
Yeah. Can I just then Donna, then I'll have you answer all of it together. Ellen, Henry, can I just ask you, like, how much time in your week did you actually devote to this? And do you do it on a more of a part-time base, full-time? How many hours? And how do you maybe do your vacations too? So Donna, when you answer the question, I'm sure people are thinking about, how can I make a lifestyle change? Ellen, can you just circle around again?
In patient hours per week, that's the patients that I would see them. Most of the practice I did 32 hours. That's just in patient visits. That's not in patient work by any means. So you probably have, I don't know, it just depends on what's going on, but anywhere from 8 to 10 hours, I would say, for making calls, to returning phone calls, to filling out paperwork, or writing up a justification under workers' comp, whatever that was it. And then you have the business end, and that was I always stayed on top of it. So I donated my hours of 4 hours a week to make sure I had everything entered in, that I knew where my expenses were. And a lot of people will just let somebody else do your expenses, but you really need to know where your expenses are, because you have to kind of figure out then how much you have to do. But I made a good income in doing that.
Okay. Henry, how about you, the time involvement?
I would say it was all consuming. It seemed like every facet of my life was doing something with the practice, especially when you first start, until you kind of settle in. And we're not talking months, we're talking some years in order for you to get established and started and feel like you're making money to be sustainable, not only for the practice, but for your life. So it does get better, but initially I would just plan to make that your life until you get established a little bit, because there's always something, right? It isn't just taking care of the patients and going home, right? It's simple things like, well, I got to clean the office before I go now. I have to take out the trash, right? The nurse calls in, I have to do all that stuff. So it's all those things. And then, as Ellen said, now you have to deal with the financial stuff, which, by the way, I hate, but it's those things that we need, because it all makes it work. You can't be without one piece.
Yeah. So Donna, that question initially was, how much time do you devote to your practice, and advice you would give to folks that may be starting?
Well, so, mine is a part-time thing. So, but, it can be a little consuming, because I try to meet my patients where they live. So there may be an appointment that we have, and then somebody's like, oops, life happened, can we move it? You know, and I'll try to find a time that works for both of us. So, you know, it can be a little consuming at times. You know, I try to sort of limit that, because I could probably be working every day that I'm not doing my other full-time job. So, you know, it requires a lot. You know, I'm not taking out the trash, but I do have a lot of things to do in terms of follow-up with patients, you know, to see how they're doing and what have you, if we've changed, I've put them on a medication or something else, just to sort of touch base. But what I like is I do have that time to develop those relationships with my patient. And I think that's what's so key. That's what makes me feel good and come back to do it again, is that, you know, I have a relationship with them. And I found that they're very respectful. I think Ellen mentioned that before. They're respectful of my time, and appreciate my time. And I'm not sitting there looking at my watch going, I can only be a 30-minute visit. You know, so I'll go over every now and again, and patients will apologize to me. Oh, I'm sorry I took so much more of your time. And I'm like, no, that's fine. We had to get to what we needed to get to. So yeah, for me, I think it's a little bit different, but it can take up a lot of your time because there's so many facets of it that you have to be on top of.
So maybe just in wrapping up this.
Donna,
Oh, go ahead.
I was just going to say, you know, Donna, in hindsight, I think that's what I probably would do. One thing I would do differently is I would start part-time if you can, and keep your full-time gig, and you know, so you can take care of a lot of the other stuff, the credentialing and building up your practice and things like that. So if you can start out in a part-time basis and then kind of fly from there, I think that's might be the better way to do it.
I mean, I think so. I have to just say, I'll add quickly. I'm sorry, Alan, I saw you were going to say something. I was just going to say, you know, I was doing a lot of house calls and then COVID hit. So it's like the fact that I didn't have a brick and mortar saved me, because I can continue to do things without having to worry about paying the rent on the practice, because I couldn't get PPE. So I was stuck and patients weren't coming out. They weren't leaving their home to go see a provider. So, you know, that would have been a financial, you know, big hit to me, even with, you know, the loan forgiveness and all that other stuff. That's even more paperwork. But yeah, I think in some ways it's a great idea to start out part-time so you can build. And I'm sorry, go ahead, Ellen.
I was just going to say, what you need to know when you go out is it takes about 3 years to grow your business, thereabouts, where you hit some financial stability. That's what you have to figure out when you're going to go out. What can you financially afford? So while I went out full force, I did a lot of consulting. Oh my God, I did. So I was in every city and I think in New York State. And of course, I started out in September 11th was in my start out year. So I was stuck in a different location than my patients were for a little bit of time. But I think that's what you have to figure out, because it would be too stressful. I mean, to me, the worst thing is financial stress. So you have to kind of think about, what do I need to make to live for that first 2? And it gets better each year, don't get me wrong. At least I didn't lose money. But then you just have to kind of take your time with it, and ahead of starting out, find out, what can I live with? Where do I need to go to what I can get? How can I save money? But the thing with saving money is you have to decide, would I be better off having a cleaning person? Is that cheaper than me spending the time doing it? I will tell you just from my own experience, a good office worker, I know you want to pay less, but you want to pay the best, because you want that very best person that is committed to you. And I had a whole range. I always said God gave me my last office manager, because the amount of stress in my life dropped by 50% when she came aboard, because she had my back. She kept up on the biller. She kept up on everything. She made my patients happy. When they were frustrated about something, she communicated it well to me. So your office personnel, to me, are the most important, and you need to reward them financially and benefits wise.
Fantastic. One closing question, and then we'll get to, we have some people asking questions in the chat. So you, with your own independent practice, when you do take that time for yourselves and your family and your friends, what do you do about your practice? You know, when you're in an institution, in a hospital, you ask someone to cover your patients, watch them. What do each of you do individually with your patients?
Well, what I did is if I were out of the country or if I had surgery, the person who was my collaborating physician at the time would take the patients for me. But quite honestly, majority of vacations, I took my own call because it was just faster and safer. Of course, electronic health records, came along and that made it a lot better. E-prescribing, oh my God, that was a gift to God. But it meant that every vacation, my first thing to do in the morning was to answer all the messages and e-prescribe whatever I needed to e-prescribe. So it's not like I always told people I didn't have any time off for 21 years, except for the fact that when I had surgery, I did because I didn't take my own call then.
Henry?
I don't take vacation. Dr. Branson can attest to that. Very, very rarely did I take time off if it was for, my kids in a hockey tournament or something and I was away, I would take the call myself. But if I was in a place where I couldn't do that, then I had some NP colleagues that would cover for me. In the rare occasion I had, when I had one, a collaborating physician, they would of course cover for me. But the vacation was never really an issue because I never really had it, which is a bad thing, by the way. I know now because I'm older and maybe a little wiser that you do need that time, right? But when you're younger and you're all in, that's kind of on the back burner. But you really need to make that time.
Yeah. We do want to think about our own self-health and resilience.
Yeah.
Absolutely. Donna, what are your tips for this?
It's me, the practice is me, but I have a practice that is not, usually emergent. So I can do those vacation times, but I'll do the same thing Ellen does. Check, messages first thing in the morning, tell someone if there's an emergency, you can always text me. And it's not as onerous as I had, when I was doing the house calls kind of thing. So I really do make sure I carve out time for myself.
Okay, well, great. Thank you. So now we're going to go to our chat room. We have some questions in the chat. So some things we may be able to answer from our panelists and other things we may have to get back to all of you and to our guests who will be listening on YouTube. But here's the first one. By the way, again, happy NP week. I see some messages in here. So is there a checklist that can be shared with this information to help NPs who want to transition to private practice? So as an NPA group with our panelists, we don't have something very specific, but in your practices, Ellen, Henry, or Donna, do you have something or a list that you use to get yourself started? Maybe we could start with that.
I think that there's online, actually, there's probably a couple of things that can give you some basic guidance, like how to, start your LLC. From that perspective, like the steps you need to take. You can, as I said before, you can go to the Department of State for New York. So the New York DOS, I think that has some guidelines on how to start an LLC. You can check with, I had said before, the Small Business Association, just to get some ideas to start to put together a plan. You really do need some kind of a business plan because you've got to think about things you wouldn't think of. Like Ellen says, making sure you have money to pay for good staff because they do make or break you. I've been in plenty of offices where, the biller may not be great, or the front office person wasn't great, or the MA wasn't great. So, those are important. And how do you find those people? How do you hire them? So I think there's a lot of stuff out there to give you some basic guidance.
Yeah, and I also think you want to make sure you have a lawyer involved and an accountant involved.
Good point.
Yeah, I would say, the best thing to do is just like Donna said, is to get a business plan. That's your whole outline of how this is going to look and how it's going to flow. And and what I would do is I would go to the places where you've graduated from, right? They have a business program, or else go to the career center. They can help you devise those plans, right? Because one of where I graduated with my nursing degree was from Brockport. So I actually contacted them because, again, I'm not ashamed to tell you I knew nothing about making a business. I'm a nurse. So I asked them, how do I do this? And they were more than willing to help you, give you information to help you get started with that process. But I think that should be the number one thing on the list. And then the other things will fall into place.
And all of you are here today because you have that spirit of inquiry, right? Wanting to get together. So your professional organizations, we're going to continue to do different type of meetings like this to keep you all connected and to answer some of those questions that you have. So thank you, Kim, for asking that question. And Sue is asking Donna a little bit, what accounting system do you prefer? Maybe all of our group can answer that. But when you think about advertising to gain patients, someone had connected with the SBA, Small Business Association, didn't have such a great response. Do you have a specific person or a branch that you're using that you could recommend, Donna? And for those providers that make house calls, what app or what have you did you find to be the most efficient? Maybe, Donna, you could start with Susan's question.
Okay, so let's see, there's a whole bunch of pieces in there. For accounting, I use QuickBooks because it's what I call simple stupid. It's very easy for me to follow, put information in and everything else. And then I take that to my accountant. I asked my accountant what was better for me to have, and he said an LLC versus an S corp versus anything else. So he advised that it will depend upon your own financial situation. Definitely, as Ellen said, you've got to speak to an accountant because different corporate structures mean different things to you as an individual, in terms of look back and everything else. So, you really want to speak to an accountant. An attorney is also really helpful in putting the right structure together for you. Like I said, I was a paralegal, so I knew what steps to take. I use the Small Business Association group out on Long Island. I don't know if it's different. I think sometimes you just have to look till you find the right person. For advertising, what I did is I actually created a brochure and went out and did calls like I was a farm rep, and I went to different practices. I left pens, I left magnets, I left my brochure, and said, hey, if you get a chance, consider using me. And it's worked out very nicely for me with like orthopedists referring patients to me who need to lose weight or to change their lifestyle. So, that was one way that I did it. I've tried, very difficult. It takes a lot of time. I'm on TikTok, I'm on Instagram. I haven't done anything in a while because it just takes so much time to create videos, to create content. And now to be very careful about the content you put out there and what you say because of recent lawsuits. So, it's challenging. You'll notice if on Instagram now everybody is saying like, I'm Dr. So-and-so, I'm a nurse practitioner, because people have been sued for using the title of doctor. So, it's challenging. I hope that answers a number of the questions.
Yeah, so I guess to Ellen and Henry about the insurance, or I'm sorry, about the advertising. How did you advertise, and any other things about the partners that you had when you were looking at small business associations?
Well, I had established patients, so I was lucky I got to take them with me. And I will tell you, probably my best referral other than physicians was patients. I do think in the age of the internet, I think you have to look at those approaches so they're going to use Google, and you're going to want to make sure Healthgrades has picked you up and some of the other things, because that will at least give them phone numbers and locations, etc.
Yeah,
Excellent.
I would have to agree, word of mouth is your best. Even today, even with the social media, word of mouth gets you further, right? Because people always talk and say, well, who do you go to? And if they have a great experience, they're going to come to you, right? And looking back, probably my best advertisement, believe it or not, was a local pharmacist, right? Because they come in contact with everybody, and he would send people. I can't tell you how many. He said, "Oh yeah, I'm always hearing from people who need a provider," and so he would refer them to me in the community. So it's those kind of things. But you know what? It's still word of mouth. But you can't get away from the advertising, getting that brand out there so people know about it.
That's great information. So now someone asking, if you're someone new coming in, thinking about your own practice, and you're starting to navigate what is out there, how do you know, it sounds like, if your niche in practice is actually open, or if the demand is out there to start your own practice in that area?
I think that's why part-time is a good idea, to find out if that's the case, if there is a need. I mean, I think for primary care, there's always a need, because, I talk to patients who will tell me, I can't get in to see my provider for 3 weeks, or, 6 weeks, or, whatever. So I think for that, there is definitely plenty of room, to grow and to, bring on patients. And I agree with Henry and Ellen, like word of mouth, definitely. I had somebody who I saw who actually was she did facials, and she told everyone she did a facial for about me. And I was getting calls and texts like crazy, just because she was, so happy with her results that she shared that. And I got a tremendous number of patients from her.
Great. Okay, so I have someone else asking a question about already, working at a specialty area in an academic hospital, needing to have a collaborative agreement for up and through the 3,600 hours. But then, if someone wants to start their own practice, if they're newly graduating, how can we fulfill that? If you're a new grad, can you still have your own practice? And really, what do you do about that practice agreement? And then secondly, can you open your own practice in a primary care area, or can you go into specialty? Hopefully I phrased that okay.
You definitely can go into specialty. I don't really know what the answer is with the 3,600. I think you really need to accomplish those hours, or you're setting yourself up. Because most of us, yep, we had experience, but you really need a couple of years down the road to have enough experience. And then if you're in a specialty arena, make sure you've got some time spent in that area so that you do have that expertise. What you want to be is more qualified than the next person.
Yeah, and I think I would stay away from right out of the gate, having your own practice, because you don't know what you don't know, right? And the biggest thing about new NPs, it's all about confidence, right? So you want to build that confidence before you go out on your own, right? Because if you're working with somebody in a multiple provider office, you have people there all the time, right? That can give you advice, answer your questions, show you things. If you're on your own, you're it, no matter where you are, right? So you always have that safeguard. So I would say to give yourself some time to develop yourself as an NP, right? And then go ahead and venture out and do your own thing.
Okay. And yes, with the 3,600 rule, keep watching for that with the Modernization Act, because at this point we do have, the collaboration under 3,600 hours, but that's something that the organization is, working for as we advocate towards legislative issues. We have a couple more questions we can answer, and we have a lot more questions in our chat room. So maybe what we're going to have to do is get these questions together and find a way to send them back to all of you. Hopefully our panelists, and we have many people that are in private practice throughout New York State, that we can do a meet your panelists session 2 up and coming. So I think that's something we're going to have to be doing, because you are all thoroughly engaged in this discussion. Okay, but now we have a question here. If you decided to initiate with a house call practice, did you select a sole proprietor tax structure or did you foresee expanding and thus select an S Corp structure? If you originally selected a sole proprietorship, was it difficult to switch to an S Corp structure? I think maybe Dr. Mazicki?
Yep, I had started out with a DBA as a sole proprietor. Then I went to a partnership, and then I went to an LLC. And the LLC is probably your best bet, no matter what you're doing, house call, standard practice, whatever it is. And the thing about the house call practice, I was talking with somebody in the New York City area, and he told me that he is credentialed as a specialist in the house call practice. So he gets the better reimbursement. Granted, there's higher co-pays, but he had told the insurance providers, I'm doing house call practice and I'm a nurse practitioner. And they told him, no, you have to be considered a specialist to do that. So he said, okay. And that's how he's practicing. But LLC is the way to go. That's what my financial folks tell me. That's what my lawyer tells me. And I think that's what most practices are into.
Donna or Ellen, would you like to comment?
Same thing, LLC, that's what my accountant and my attorney said.
And some people do say that LLC should be set up out of state because it's harder to pursue any legal action.
Okay, so a few folks were asking some of those same questions. I hope we answered them for you. I'm going to move down to I found that independent health requires a collaborator despite the law change in 2022. Have you found that other insurance providers have required this as well, or are they the only ones?
They aren't the only one. And part of the reason is our act isn't permanent yet. So the insurance carriers are in no hurry to get away from that collaborating provider. Plus, they always have the option to require that. Now, in some of the insurance carriers in the Western New York region, they will, if you're doing family practice, grandfather you in because without a collaborating provider, because there's such a shortage. And psych is another one. You have to meet with each insurance carrier. He has the right to make their own decision, which is a terrible thing to say. But I think once we get permanency, and I can understand why they haven't done that, because it's easier for them to make us have a collaborating provider, right? Before having to go back if the law doesn't get changed permanently. But that's what we as a group, and if you're in Region 1, this is what we started working with the insurance carriers, but we need more people. We need more people complaining about not being impaneled without a collaborating provider.
I think I'm a little bit more pessimistic than Ellen on that issue, because it's great that we get legislative change to make things the way that they should be, but that no way guarantees that the insurance companies will follow, because you have to remember you're making a contract with another company. That's all that is. You're contracting with them and they outline everything for you. And if one of those things is you have to have a collaborative agreement with a physician, they don't care that New York State says you don't. They'll tell you then don't take our insurance.
Donna?
% same. They're not the only ones out there, and that's why I do private pay.
I'm liking that more and more, as I get older, that DPC model is pretty appealing.
All right. Well, we have a couple minutes left. I want to thank everyone for being here and our panelists. It's really important to continue to advocate for your profession, be a part of it. We know that all of you are here, and all of us generally say that we need to get more nurse practitioners to be part of the only professional organization in New York State that supports all of you and all nurse practitioners. We have about 33,000, and only about 12% of nurse practitioners are a member of the organization that is doing all the legislative work to advocate for all of these issues. So please tap someone else on the shoulder in the spirit of Nurse Practitioner Week. Get another colleague to become a member. We have institutional discounts out there. We have student discounts out there. And we want to keep having these sessions to inform everybody. I really thank you for being with us today. Look for this discussion on YouTube, and look for all the other Nurse Practitioner Spirit Week events going on. We have student panelist discussions. We have NP leader discussions. We have Q&A with our government affairs chair, Joy Elwell, coming up this week. And we have another speaker tomorrow. So thank you all for being with us. And hopefully we will see you with another panelist discussion soon. Thank you, Dr. Batista, Dr. Mazicki, and Dr. Willenbrock, and all of you for being here today. Thank you.
Happy NP week.
Happy NP week.
Happy NP week.